So this is article Exposition group number 9. We have the diffusion of innovation theory, and it was done by Carey-Stone and Jessica L. Golub. The main purpose of the article, which is from the National Cancer Institute, the theory at a glance, which is a guide for public health professionals to utilize summaries of the health behavior theories in one single source. 8 theories are presented in a reader-friendly summary. It showcases how theories can be used to implement health-promoting programs, particularly with a view to cancer prevention and control. This presentation will focus on one such theory, which provides a framework for an approach to a healthcare issue. The diffusion of innovations theory. This theory is an application of the ecological perspective, and this theory applies to the community level of influence. So background on the diffusion of innovations theory. In 1962, Everett M. Rogers, he was a communication theorist and sociologist, wrote and created the diffusion of innovation theory. It was from his book, which was called The Diffusion of Innovations Framework. It was a framework that helps us understand how an innovation spreads throughout a community or a population. And the innovation could be a new idea, a new practice, or a new product. Diffusion of innovation theories is based on how an idea, behavior, or product spreads over time through a population or social system. So the assumptions underlying authors' thinking about the diffusion of innovations theory. So it helps to understand that while it would be great if everyone just took to a new idea quickly and readily, it is not the norm for everyone within a population to behave that way. Rather, there are key groupings who must be approached in different ways to get the same end result, which is a healthy new behavior. So this chart shows us that the principal idea is for 100% of a population to adopt the innovation or a new approach to public health. The bell curve underneath the cumulative uptake line shows us the difference in uptake versus adoption over time. This showcases that initially the same share of adopters and the rate of adoption were pretty much even until the rate of adoption slowed down. The theory was adapted by health professionals, however, it is used in many different fields. For example, businesses, technology, communication, and public health. Innovation needs to be useful to people, and society need to be ready to adapt to the new innovation. When presenting the innovation, there are 5 groups that need to be targeted for the innovation to be successful, according to Rogers. And each group needs a specific strategy. The innovators, they represent 2.5% of this bell curve. They are the first to want a new innovation. The early adapters, they represent 13.5%. They are opinion leaders who embrace innovation and change easily. As we've learned in Dr. Ankerman's lecture, the early adopters and early majority are critical for the success and the acceleration of diffusion of the innovation. So the early majority, they're not classified as leaders, but they do adopt the change more quickly than the average person. Late majority, they're more skeptical of change. They need to see evidence of the adoption of the innovation by the majority of the population. In the laggers, they're even more skeptical of change. They're not very risk-taking, and they don't change easily. According to Rogers, diffusion of innovations theory is the process that an innovation is communicated through specific communication channels over time among the members of a social system. Applying the diffusion of innovations theory can take different approaches in terms of intervention strategies. which could be targeted specific to the group, either early adapters, innovators, early majority, and so forth. Different approaches will impact different groupings within a population over time. It takes the individualized approach in the health belief model and then extrapolates that to a community level approach. Diffusion of innovation can be assessed at various levels of the ecological perspective. Acceleration in the rate of diffusion is typically the result of influential members in the social system adapting the innovation and communicating that message to others. So in this slide, this is the concepts of the diffusion of innovation. So first, there needs to be a new practice or product or an idea presented to an individual or a community that they see usefulness in. And then there's the communication channels of how the innovation transfers to one person to another. Social systems is a group that is targeted to adapt the innovation. And the time is the amount of time for an innovation to be adapted. So this is the communication channels. At first, in the communication channels, there needs to have knowledge that the innovation exists, and there needs to feel like there's a need for the new innovation. The norms of the social system is also a condition. And the characteristics of the decision-making unit. So they include the socioeconomic characteristics, personality, and communication behavior. So all those things are key in order for the communication to get spread. And then the second stage is persuasion, which these are factors that are key attributes that affect the speed and extent of an innovation diffusion. So this will be talked about in a later slide, but if all these fit in with the new innovation, the speed and the rate of that community takes to it is faster. So then in the communication channel, the next one is whether a decision to adopt it or reject it. So if it's rejected, then the new innovation ends there. If it gets implemented, then it will continue on, and then the confirmation, that's when someone will talk about, hey, this is a great new thing, and the innovation spreads through that. So it's either it continues being adopted or they will reject the new innovation.
There are 6 key factors which affect the speed and extent an innovation spreads through a population. Those are relative advantage, so that's whether the innovation is better than what is already in place. Compatibility, so will the innovation work well within the target population. Complexity, how easy is the innovation to use or to implement. Trialability, are we able to try the innovation before adapting? And observability, which is the success or failure of the innovation needs to be measurable and observable. This chart is a visual representation of those key factors, all of which need to be present for the innovation to be adopted on a wide scale. As with other theories in the Theory at a Glance publication, diffusions of innovation theory can be extrapolated to many areas of public health. We will discuss its application to the implementation and promotion of the coronavirus disease vaccine, which was the public health response to the global COVID-19 pandemic. Diffusions of innovation theory can be prefaced by thinking about explanatory theory and change theory. We need to ask, what is the problem, situation, or behavior? And so in our example, the problem is defined by the COVID death rates, overwhelmed hospitals, and varying degrees of success within populations following masking suggestions, stay-at-home orders, and also varying degrees of contact tracing from state to state and beyond. And the second question is what can be changed? So the vaccine was developed which could reduce the severity of symptoms, decrease mortality rates, and instill a sense of normality over time. We can apply the key attributes of diffusion theory to the vaccine rollouts. By asking what is the relative advantage, we have to consider, is the innovation better than what it will replace? So what it was replacing was that there was no vaccine available. In terms of compatibility, in our example, we ask, does the innovation fit with the intended audience? And so vaccine trials demonstrated medical efficacy, and the intended audience initially was those within the elderly or vulnerable populations, people who were worst affected, most likely to require hospitalization and most likely to die. And as time went on, the vaccination intended audience was expanded to all adults and also to children. Complexibility asks, is the innovation easy to use? And the answer to this question in our example is more complex and shows how the speed of diffusion can be slowed down due to this key attribute. While if we think about Massachusetts in the US, the COVID-19 vaccine was quite quickly available per the intended audiences described and was easy to administer by health professionals through expanded clinics. In other parts of the world, getting the vaccine into people's arms is more challenging, with storage and refrigeration challenges, logistics and transportation, leading to lower rates of vaccination and more difficulty in using it. In terms of trialability, we ask, can the innovation be tried before making a decision to adopt it? So with our example of the COVID vaccine, medical vaccine trials were completed before the vaccines were approved for widespread usage, and volunteers were able to participate in adoption during this time, and perhaps that might sway the decision of some within a population to adopt or not. Also, since the vaccine was developed using existing vaccine technology, one could argue that in some ways it was already trialled. For example, building upon known medical knowledge of the severe acute respiratory syndrome, SARS, outbreak in 2002 and Middle East respiratory syndrome, MERS, in 2012. If we think about Rogers' process of adoption bell curve, here's how it applies in our example of COVID vaccine uptake or adoption. The innovators are the volunteers in the vaccine trials. They show no fear of risk and enjoy being part of new things. In the early adopters group, this group includes those key public figures whose televised vaccination may have encouraged others to adopt the vaccine and increased understanding of safety, assuaged risk of side effects. In our example, this group also includes targeted populations, such as with medical risk factors, making them especially vulnerable to severe symptoms, and perhaps even healthcare workers who had early access through calculated employment policies which mandated vaccination. Within the early majority group, in our example, this refers to a much larger contingent of the population, so that when the vaccine availability was opened up to adults in younger age groups and with fewer medical risk factors. The late majority grouping may include people who initially had vaccine hesitancy, but through public health education efforts, workplace vaccination mandates, or other factors have now decided to adopt the vaccine. This group may also include children age plus for whom the vaccine was developed later, and may also include people considered late majority adopters due to lack of access. And in the final grouping, the laggards category, this group may include much younger children for whom vaccine development came even later, so babies 0 to 6 and children under 12. It may include people who are not willing to adopt the vaccine at all. It may include people who cannot adopt the vaccine for medical contraindicated rationale, and it may include people who cannot access the vaccine due to socioeconomic reasons, those structural determinants related to access. As we have learned through Dr. Ackerman's lectures in this class, for the COVID vaccine or any public health initiative to be most effective, more than one public health theory should be applied. So more than just the diffusions of innovation theory in isolation. As we've discussed, explanatory theory and change theory help to identify a problem and the proposed solution. Health belief theory also needs to be applied so that we understand how best to persuade people and populations to adopt innovation. And communication theory really pairs well in conjunction with diffusions of innovation because it is really focusing on how to best get the message that this innovation is the best thing for us to do to the widest swathe of the population. There are several limitations or shortcomings to the diffusion of innovation theory. Much of the evidence for this theory, including the adopter categories, did not originate in public health, and so it was not developed to explicitly apply to the adoption of new behaviors or health innovations. It does not foster a participatory approach to adoption of public health programs, and it seems to work better with the adoption of behaviors rather than cessation or prevention of behaviors. The theory has some critiques, including that it shows pro-innovation bias, which means that whilst new ideas and innovations might be very popular with the scientists and the innovators who design them, it's not always the case that it's beneficial for all members of the population to adopt an innovation. The theory may contain some individual blame bias, whereby the non-adoption of innovation is blamed on the individual rather than the implementation strategy. The theory may suffer from recall problem in terms of categorizing individuals within those 5 groupings. And there is certainly an issue of equality. Innovation is not always distributed evenly among the population. And so cost of the innovation is not a factor in the theory, which may certainly account for why some individuals are grouped in that last category, the laggards category. Its success is reliant on influential members of the social system who may not be ready or want innovation. So for our example, there are influential people in society who are opposed to the vaccine and may stall its success. Time within the theory of diffusion of innovation specifies that as time goes by, more people should adopt the innovation. However, innovation uptake may actually diminish over time as new ideas replace what was the original innovation. And again, just to reiterate that success of implementation is also relative to the structural determinants of health. For example, technology, logistics, housing environment, and urban versus rural external environments. In conclusion, the diffusion of innovations theory shows us that when implementing a new public health approach or initiative, rates of adoption vary within a population for a variety of reasons. Those working within the field of public health can seek to understand the speed or delay in innovation adoption by asking key questions within diffusion theory and seeking to understand the theory's key concepts. Effective and sustainable disease prevention and health promotion needs to take measures at every level of a population, individual, organization, and community, and design implementation measures accordingly.